October is Breast Cancer Awareness Month, and today WBZ was proud that members of our team attended the Breast Cancer Research Foundation Symposium in Boston.
WBZ's Paula Ebben was a big part of the presentation. Our news director, Gerardo Lopez, also there to support the cause. BCRF is the largest private fundraiser for breast cancer research. All money raised in New England stays in New England. This year, BCRF is awarding more than $8 million in grants to researchers. One of those is Dr. Partridge from the Dana-Farber Cancer Institute. And tonight she tells Paula about some alarming new numbers.
The bottom line is that we're seeing more diagnoses of breast cancer among young women these days. The numbers are going up nationally in the United States, and we're trying to figure out not only why is this happening, but what we can do to prevent it.
Dr. Partridge is a Dana-Farber breast cancer researcher with a focus on women under 40, and what she sees is alarming.
It may be happening because of the fact that young women are generally not screened and they get more aggressive breast cancer.
In fact, a 2020 study shows an unsettling trend in this age group in the U.S., a significant increase in stage 4 breast cancer among younger women, and the number of 25 to 39-year-olds with metastatic breast cancer going up 32% in recent years. Dr. Partridge thinks one reason may be putting off pregnancy.
That's a sociocultural phenomenon. Women are waiting to get through their careers and live their lives. And at the same time, we know that having babies before 30 is protective of our lifetime, whereas having babies after 30 is associated with an increased risk of breast cancer in the short term.
Whatever the cause, she warns if young women notice any change, it's crucial to act and ask questions.
If a woman thinks there's something wrong, but perhaps she gets intimidated talking to a doctor, what are some good questions to ask?
I think it's really important for a young woman to know her own breast topography or what her breast feels like, and to be able to say to her doctor, look, I'm hopeful it's nothing to worry about, but it really does feel different, or it's really scaring me. Do you think we should get another test to evaluate it?
And if a doctor orders some sort of testing, whether it's a mammogram or something else, insurance should cover it.
Generally, if you're working up an abnormality, a lump or a bump, insurance absolutely should cover the evaluation of that change that you're looking to evaluate.
So many people missed medical appointments during the pandemic and the lockdown. What's your message now about getting in to be tested?
We've already seen a bit more advanced stage breast cancer walking in the door because of the shutdown and because of some of the delays. And so we're encouraging all of our patients and women who are worried about a symptom, and certainly people who are in the right age or risk groups to get screening, to get their screening done, get them scheduled and get in and have the test.
And Dr. Partridge adds another big issue is getting treatments that work to all populations. There are a lot of healthcare access problems in the U.S. and around the world. And another way that BCRF helps support research is trying to improve access and understanding about therapies to populations that, for whatever reason, have been difficult to reach. David and Lisa?
And that is critically important. Paula, thank you.